At this moment, let us open our seminar with our next talk of the afternoon. Medyo mahaba. Dr. Ronelo Avila is the sub-regional representative for Southeast Asia of the World Organization for Animal Health. Dr. Avila is a Filipino veterinarian who graduated as a Doctor of Veterinary Medicine, DBM from the University of the Philippines, and had a Master of Science in Epidemiology and Preventive Veterinary Medicine from Free University of Berlin, Germany. Dr. Avila joined the OIE in June 2004 as he was given additional tasks to manage the OIE USAID program on strengthening veterinary services in Southeast Asia until March 2009. And in April 2009, he was appointed as the OIE Sub-Regional Representative, concurrent with his position as a Regional Coordinator of SEA FMD campaign. Dr. Avila has a wide experience in managing disease control programs, and among the major contributions of Dr. Avila is development of the SEAC FMD Roadmap 2020 and in assisting countries to control FMD. He is also instrumental in the eradication of FMD in the Philippines and in various OIE support to control FMD in Myanmar and Lao PDR. He also coordinates the sub-regional control of rabies in Southeast Asia, supported by One Health component of East Asia Dog Rabies Elimination Strategy, which was later transformed into the Asian Rabies Elimination Strategy, or ARES. To talk about One Health approach on animal health and disease control in the region, please give Dr. Avila a round of applause.
Thank you very much, Dr. Cora Occidental. And of course, I would like also to take this opportunity to thank FAVA, the President, Dr. Korochi, and of course, the officers of FAVA who are here, okay, and of course, the Director of FAVA, Dr. Acharia, and then the President of TBMA, and all the colleagues who are in this room. Thank you very much for this occasion, for this chance for, again, we are now WUA, the World Organization for Animal Health, to share our activities together with the quadripartite in the implementation of One Health approach to strengthen animal health and control diseases, including zoonosis in our region. Okay, just again, a short introduction why One Health. It has been mentioned by Dr. Karochi, our really main role to improve the health of the global health, our society, for the future, not only for our generation, but hopefully for the future. As you can see at the center, we are looking for a green planet with a healthy life for everyone. We have encountered so many challenges during the past 20, 30 years with the occurrence of different zoonotic disease, starting from SARS-CoV-1, and then with the previous SARS-CoV-2, which recently with the epidemic has been put under control. And all of this is due to the different changes in the different areas in our planet, the damages in the ecosystem, intensification of agriculture, the annual production, pollution, migrations, changes in climate, urbanization, so on and so forth. So with this, we have an increased global interaction between human, animal, and environment interface. And in our region, the Asia Pacific region, we are considered as the hotspot for emerging diseases. 52% of the population lives in the cities and urban areas, and more than half of the world's mega cities are now found in our region. With this extensive travel network, the Asia Pacific is a hotspot for biodiversity loss, high population density, cross-border movement, risky human behavior on cultural practices, and the natural disasters. So because of this, globally, the quadripartite has launched the new approach, broadening the scope of One Health. So when One Health was first introduced in 2004 and adopted globally by the UN and the tripartite then, it was mainly focused on controlling zoonosis. But now, we have broadened the One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of the people, animals, and ecosystem. It recognizes that health of human, domestic, and wild animals and plants, and the wider environment, including ecosystems, are closely linked and interdependent. So, we are looking at now a more wider scope of our One Health. And with that, the quadripartite has launched what we call the One Health Joint Plan of Action in order to support globally all countries in improving implementation of One Health. There are 6 tracks, and I will put more, I would say, more specification in these 6 tracks. First is on enhancing One Health capacities to strengthen health system. Second is in reducing the risk from emerging and re-emerging zoonotic epidemics. And the action track number 3 is in controlling and eliminating endemic zoonotic diseases, including neglected tropical and vector-borne diseases. Number 4 is in strengthening assessment and management of food safety risk. Number 5 is in curbing the antimicrobial resistance. And number 6 is integrating environment into One Health, environment and wildlife health into the environment. Okay, so for action track number 1, we are looking at strengthening systems, establishing a foundation for One Health capacities, and also for enhancing One Health operationalization, looking at the workforce, resources and mechanics, and in the monitoring and evaluation for the implementation of One Health. Okay. So for action track number 2, in reducing the risk from emerging and re-emerging diseases, we are trying to understand the drivers and emergence and the spillover and spread of zoonotic pathogens, particularly for unknown pathogens that's still in the environment. So we are trying to identify what could be the risk that it might cause a spillover. We would like to strengthen national, regional, and global One Health surveillance and early warning systems in order to prevent future risks coming from unknown pathogens. For action track number 3 is mainly to focus on working with endemic zoonotic diseases. And one of that is we are looking at rabies as one of our pilot disease to control, which has been really causing mortalities to humans because we could not control rabies in dogs. So with this action track, we would like to enable countries to develop and implement community-centric and risk-based solution to endemic zoonotic diseases, ensure the harmonized application of One Health principles at all levels by implementing practical measures to strengthen local, national, and regional and global policy framework, and to increase political commitment and investment in the control of endemic diseases. And we are trying to look at rabies as our model disease for this. For number 4 is mainly on promoting food safety by reducing the risk along the market chain. strengthening national capacities for food controls and risk inspection based on international standards, utilize and improve food systems and data analysis, scientific evidence and risk assessment in developing policy and in making risk management, and strengthen national foodborne disease surveillance system. Action track number 5 is focused on the antimicrobial resistance, and I would like to thank FAVA for really taking really a major role in promoting antimicrobial reducing antimicrobial resistance in our region. So under action track number 5, we would like to strengthen the capacity and knowledge of countries to prioritize and implement context-specific and collaborative One Health work to control AMR in policies with support of legislation and practice. We'd like to reinforce global and regional initiatives program to influence and support One Health in response to AMR, and of course, strengthen global AMR governance structure. So in 2024, this coming September, the UN will again revisit the Universal Declaration for AMR, and some of the work that we have done in our region, we would like to promote into this UN declaration, UN meeting again in September. And some of our countries will be highlighted on how we will able to reduce AMR in our region. And with this, I would like to congratulate Thailand, which is one of the countries that will be highlighted as a case study in reducing the AMU, the reduction of the antimicrobial usage in the livestock production, and also in the public health usage of antimicrobials in Thailand. So for number 6 is mainly to focus environment and wildlife. And this is one of the biggest work that we would like to emphasize, because for the past since we had started the tripartite in 2010, collaborating on One Health in our region, the participation of environmental health sector is still not that strong. So we expect that since the United Nations Environment Program joined the tripartite to become a quadripartite, we expect now that the environment sector will be, of course, be more active. And of course, with FABA and with the launching of in Fukuoka, the One Health Center, this will really help a lot in strengthening the action track number 6 to involve environment sector in our One Health work. So with this, the following mentioned in the bullets is to protect, restore, and prevent degradation of ecosystem, mainstream environment into One Health, integrate environmental knowledge in evidence in developing One Health decision, and create an interoperable One Health academic and in-service training program for environment, medical, agriculture, and veterinary sectors. So the next step is to implement the One Health Joint Plan of Action at the national level. So we have launched also the implementing guide with the 3 pathways of change. Okay, so to focus on governance, policies, and legislation. So legislation, that's why I really appreciate the work that has been done by our President, Dr. Karuwesa. So engaging politicians. Politician is very important to ensure that we have a legislative support. Number 2 is organizational development and implementation of sectoral integration. And of course, third pathway is on data, evidence, and knowledge exchange. So with these 3 pathways to support the implementation of the 6 action track, hopefully we could work now in implementing in our region. So the quadripartite here in Asia and the Pacific, together with FAO, United Nations Environment Program, the World Organization for the World Health Organization, and the World Organization for Animal Health are working together to implement now to roll out the Health Joint Plan of Action. So in September last year, we organized a workshop here in Bangkok, September 5 to 8, to bring all the four sectors in our region to discuss how we could implement the One Health Joint Plan of Action. So we discuss each country with the help of the quadripartite and of course the three sectors, animal health, human health, and environmental health, working together to develop the joint plan of actions. Okay, so with that, we were able to advocate and familiarize on the One Health Joint Plan of Action and its implementation guide. And we support countries to better understand so they will be able really to align what they have existing One Health program with the One Health Joint Plan of Action. So in that meeting, the participants were well oriented on the One Health Joint Plan of Action and its theory of change. The member state identified the gaps using the three pathways of change and in the implementation of the 6 action track, in developing a country roadmap, and the member states also identified regional gaps for South Asia, Southeast Asia, East Asia, and the Pacific, and generated a list of recommendations to address these gaps. And the workshop came up with 3 sets of recommendations for member states and the quadripartite to follow up action. Now, for the specific per WOA, we would like to share how we contributed with the tripartite in improving animal health and welfare in our region. So WOA is an actor of the global One Health architecture through the quadripartite collaboration and its regional bodies. So starting with the sustainable development goals and now with the global One Health Joint Plan of Action. So along with the 7th strategic plan, we are working together with this. Under action track number 1, one of the work that we are really contributing, particularly with the help of FAO and WHO, and now with the involvement of UNEP, we implemented the National Bridging Workshop, the IHR PBS National Bridging Workshop in the different countries. Okay, so as you can see, we have started that in Indonesia in 2017, Myanmar in 2019, and in Thailand 2022, and the Philippines also in 2022, and last year in August, just imagine in August we have 3 countries, Laos PDR, following week Vietnam, and then Cambodia. And all of this, we are identifying what are the gaps in terms of the animal health, human health, and environment to strengthen the capacities in order to be able to implement the One Health activities in the country. So the roadmap, as an output from all these IHRPBA's bridging workshop, is a specific roadmap which has a specific activities with the timeline and who are the players. So with that, we are very clear in the implementation and how they could implement. Some will be implemented in 2 to 3 years, and then we will have a follow-up after that. So common gaps that I identified after the implementation of this National Bridging Workshop are the inefficient adequate coordination, collaboration, and communication among relevant stakeholders. So one of the recommendations is strengthening the governance mechanism within the countries, the One Health governance mechanism. The lack of environment sector representation. So this is an issue also that we would like to strengthen participation of the environment sector in the One Health activities of the region. Next is the insufficient workforce competence on One Health. The lack of legislation support. It's coming always, the support at the country level. We need the support of the politicians to implement One Health in the countries. And of course, with that is the funding. So with the support of the legislation of the politician, we need to mobilize resources to implement country-level activities. Okay, so as a follow-up, some countries after the implementation of the bridging workshop, like Indonesia, they have hired a catalyst with the support from FAO. For the Philippines, after that workshop, a follow-up was conducted in May to update the FICSI, the National, the Interagency Committee on Zoonosis, to review its terms of reference and to update the national strategy, the One Health strategy in the Philippines. And also, in November, the Philippines conducted a joint risk assessment for Henipa viruses. So they are now looking at how to protect, to prevent, to take emergency action in case Henipa virus, which was they have experienced in 2014 in southern Philippines, in order to identify the risk and how to mitigate the risk that it will not have a big impact in case it will happen. It could be managed well. In the pipeline, the Philippines now will also be conducting MCM operational tool. MCM is multi-sectoral mechanism to strengthen the One Health mechanism of the Philippines. For Thailand, they have conducted a high-level workshop on national One Health coordination. And this workshop is also to strengthen the One Health coordination mechanism in Thailand. So the tripartite has what we call the tripartite zoonotic guide, and the WUA is supporting in the implementation of these different zoonotic operational tools. The GRA, the MCM, the CSOT, and so on, and there are additional tools that are in the pipeline. Okay, so in terms of strengthening veterinary services, we are, the WUA is working closely with the countries to strengthen animal health system as our contribution in the strengthening of the overall public health public health systems. The WUA, the animal health system, we consider is part of strengthening to counter, to promote health security of the country. So that's why we are working closely with the veterinary services through the PBS pathway, or the performance of the veterinary services. Specific to action track number 3, okay, we have mentioned how we contribute action track number 1 and also partly in strengthening surveillance system and action track number 2. Now, in terms of action track number 3, the contribution of WUA is mainly to assist ASEAN in updating the ASEAN rabies elimination strategy to align it with the Global Strategy 2030. So in May 2023, we have worked with the ASEAN member state with the participation from animal health and human health to work in Bali to update this ASEAN rabies elimination strategy. So this is now the updated ASEAN rabies elimination strategy by 2030. So we are working with the countries to update based on these 4 pillars of the strategy, and we are working closely now the different projects on supporting countries to control rabies. Okay, so we have different work in Indonesia, in Cambodia, and also in some other countries. In terms of AMR, a lot of activities is ongoing to support with, in partnership with the quadripartite, different countries, different activities in the countries. And we have also the specific support coming from the AMR MPTF project in Indonesia, Cambodia, Bangladesh, Mongolia. And we have also the funding from UK Fleming Fund and EUMR. So a lot of ongoing activities under EMR. Just one announcement, this coming June, the WUA together with the funding, together with FAO and WHO, and with the funding coming from EUMR, will be organizing a workshop for substandard medicinal products to monitor these substandard medicinal products in our region. Okay, in terms of food safety, action track number AMR is action track number 5, food safety is action track number 4. So we are also working with a quadripartite to promote awareness on food safety, we organize different workshop and capacity building activities, as you can see in this. I don't have to enumerate all the list that is in these slides. Okay, and then also to work in neglected parasitic zoonosis. So we work on to develop awareness on the different parasitic zoonosis also. And for action track number 6, we have the WUA Wildlife Health Program. So this is led by UNEP, and we are closely cooperating with FAO, WHO to work with UNEP in implementing the WUA Wildlife Health Program globally. So in our region, we have worked closely in developing the Southeast Asia Wildlife Health Network. And there are upcoming activities to strengthen the regional and wildlife health network. And one of these is to set up a collaborating center in our region. So we are working on that with the leadership of Singapore and also with Thailand, the Mahidol University Wildlife Health Center. We are working closely that in the future this could be developed as part of our centers of excellence to promote wildlife health in Southeast Asia. So in my concluding remarks, the WUA will continues to work closely with quadripartite to implement the the One Health Joint Plan of Action and its implementation guide. We will be continue supporting the countries on this. We will collaborate in development of also of the collaborate with quadripartite in looking for funding and resources to implement National One Health Action Plan, and also in assisting the ASEAN Wildlife Health Network. Last year, ASEAN Summit has declared One Health Joint Plan of Action, supporting it. So we are now closely working also with the ASEAN. We are also supporting the One Health Laboratory Network of ASEAN, with AMR, with the ASEAN Rabies Coordination Group to implement the ARIS, and also to enhance the wildlife health sector in ASEAN through the various ASEAN platforms, and to support joint capacity building activities to promote One Health. With that, I would like to thank everyone for your support, and for, again, thank you for allowing us to share our activities. Thank you very much.
Thank you very much, Dr. Avila. We are really appreciate, especially for the war support, FAVA, along the time that we have done together in many aspects, not only for the One Health, but I think the most important is the veterinary education for Southeast Asia. Thank you very much indeed. Yes, I think maybe you have some question in mind, but we will have a general panel discussion after this. So please keep your question, and then after that we will have a general after our speaker, next speaker. And during the time, we also serve coffee in front of the room. You can have a little bit relaxed and go and take a coffee and come back. I think we won't have any coffee break during the time for interrupt you, because we have so many coming speaker, which is very interesting topic to listen. So in this case, just kindly go outside and take the coffee and grab some cookie together. And while you listen the lecture, you can also drinking the coffee at the same time. Yes, please enjoy.